So this is one of the type of applicators for high dose rate brachytherapy to the breast. This is the mammocyte that comes in different size depending on the tumor cavity. And this balloon is inflated directly in the tumor cavity, and this stem here comes out of the breast, and this part remains inflated throughout the whole week of the treatment. So the treatments are from Monday to Friday, twice a day. And the woman can go home. They feel sometimes a little bit of pressure, but most of the patients say that it's very comfortable. So this is the actual HDR unit that houses the small isotope of radiation called iridium. And how it works, the patient can lay on the table with the catheter coming out, and there's a little adapter here that I don't have it with me, but it's a little connector that's then attached to this, connect to the mammocyte, and then directly connected into our HDR unit. And this is really how the source will glide out of the machine. Inside here, there's a little track and go in the middle of the balloon. And depending on the size, it's all computerized and calculated for the patient's anatomy. We'll stay there a few minutes and give its radiation to a very precise margin around the balloon. When the treatment is done, the source is retracted safely into the machine. This is disconnected. We put some gauze and some bandage, and the woman can go back home for the rest of the day and come back later in the afternoon for her second treatment. Well, she doesn't feel anything. It's like having a chest x-ray. So when the radiation glides into the balloon, the patient is not aware of it, basically. She just lay on the table, and then it's all computerized, the source goes back out. She doesn't feel anything. Really, during treatment, some of the discomfort can be really sometime at the site of where it comes into the breast, a little bit of pressure because of the balloon, but I have to say none of my patients really needed any nausea, nothing. Sometimes a week or so after the treatment, where just under where the balloon is or where the scar, she could have some redness. We usually take it out. There's no stitches or anything. So after her last treatment, I deflate the balloon. It's very easy from this part, just like all the liquid in it, and then I put a little bit of numbing agent at the area of the skin, and it just glides out. The latest recommendation from ASTRO, the Radiation Oncology Society, is really very small tumor, less than 2 centimeters. Women age more than 60, margin negative, invasive ductal carcinoma as a type of breast cancer, and it has to be very well localized, not multiple little site of tumor. So really one single type of tumor. We don't accept any lymphovascular invasion or any lymph node positive. So it is very precise criteria.